their dossiers from English into French or the vice versa, or when they need inputs as to how to enter the pharmaceutical markets of the various countries surrounding us. Because I've been around most of them, so at least I have some knowledge from there. So that's a little about me.
Thank you very much, Doc.
You're most welcome, sir. So if you have anything that you need French input, I'm always available. You just need to knock my door, then we shall work it out.
That's very fine, Doc. And I'm sure where I spoke in earlier, you understood that one too.
Now my airway is going. I was learning it seriously. Now, because I have also the Siba Hospital in Hohoi.
Okay.
I used to do locum service at that when they were starting the facility. That's the new one before you enter the town. They have a new branch at the entrance to the town, but the main one is you go a bit inside after the Bank of Ghana, if I'm not wrong. Yeah.
Okay. All right, Doc. So you are most welcome.
Thank you.
Our participants on.
Thank you so much.
Kindly carry on.
Yes. So managing customer service, of course, in the healthcare sector is an important topic, and more or less the outline we are going to look at. And we want to see how best, through your work as a health information officer or manager at the various facility, how best you can help in what? The facility growing. Because if they don't get the customers, the facility cannot grow. If the service is not of quality, they cannot grow. But then you need the right information from the customers in order for management to take the appropriate decision to streamline things, to let the organization work to its optimum. So that is why it is important for you at least to have a knowledge from customer service perspective so that you add to whatever your professional knowledge that you have to continue in life. So it's an important topic for people to go through. And to really look at this, it is important for you to understand who a customer is. Aside that, you also need to understand what service is, or for you to better appreciate the importance of managing customer service. So the customer or customers are groups of people in terms of who a customer is. So we say that customers are a group of people who receive goods and services or ideas from a seller for an agreed consideration, which is usually monetary. So, or in the other sense, we can say that a customer is someone who interacts with a business entity. That means with a business organization in order to fulfill the objective of the business. So any business setup, they have an aim, they have an objective they want to achieve. So the customer is the one that will interact with this business entity based on their objectives in order for the company to be able to achieve that purpose. If you don't get a customer interacting with you, or you don't get a customer on board, then it means there's no even need for your existence. It means that the service you are rendering in the market, they are uncalled for, they are unwanted. So anytime you see an organization coming up, it means that there's a service or there's a product that is unmet in the country, or in other words, there's an unmet need that that company is coming in to fulfill. I hope it's clear now. So we say that customers are the people that will interact with this organization in order for in terms of monetary exchange, for the company to achieve their target. And of course, that's what the word here is, that agreed consideration. So if I agree that you will come and build this place for me and I'll pay you this amount, then that is the agreement. I have to do it and for you to pay me. If I agree to come to your hospital or your health center or your facility in order for me to be taken care of with regards to my health, That is the agreement I have with you, and then there's a price to it I have to pay. Once I pay that price, it is expected of you to grant me that service. In other words, the customer could be an internal customer or an external customer. So the internal customer, you as a staff, in respect of the facility that you are working, you are what? A customer to that facility. Let's take, for example, I'm at the university hospital. So there I am a customer, but I am an internal customer to that hospital, to the medical center. Then the external customer, or who are an external customer, these are the individual from your evoke set. The people, if I say from the evoke set, I want to say that clients or customers or people who think about you. In fact, they know about your existence and they think about you. And when they want to go and buy something, you come to their mind. So if you are an organization or you are a health facility, you are there, your customers or your clients don't know about you, there's a problem. Or they know about you, but they don't think about you, then there's a challenge. Because I can know you, but once you don't hit or you are not reflecting in my brain, it means I can easily forget you. But for you to say that, okay, this is my customer, then that customer should be able to what? Think about you and then know about your existence, so that whenever they want to go and buy something, you come to mind, then they will move. So the customer could be internal and external. If you are the internal, so you are a staff for a particular hospital, and you are not satisfied even with the internal culture, or you yourself, you are not happy with the service rendered to clients, then you can imagine what will happen to the external customer. So it is always important, or it's always incumbent for every organization to ensure the internal satisfaction of your internal clients, so that they will now become your word of mouth. In fact, in this sense, good word of mouth to other people. That is how critical it is as far as you are concerned as a staff, for you yourself to be satisfied with the service that your organization is delivering before you think of your outsource or your external customers also liking the service you are delivering. So the service, on the other hand, so services are the D's, the processes and performances. And these are tied to what? Service delivery. So the D's, the processes and the performances are the services. And we are saying that they are tied to what? The service delivery, which is performed by the service intermediary. The service provided in support of firm's core product defines the customer service. The customer service management is then anything relating to the customer, so that they can become loyal advocates of your brand. Don't forget, we said that a customer is somebody that knows about you and thinks about you as and when they want to go and purchase something. So they need to know about you and give good word of mouth about you to other people. They need to be loyal to you. Whenever they want to engage in any purchase or whatsoever, you come to their mind. So your ability to manage this, or to have a very good relationship between your customers and yourself, is important for you to achieve your objective, and also for you to let the customer becomes loyal to you. Service is, but it is important also for us to understand that the service is different from what? A product. So where you find yourself that you are working as a health information officer, what you are rendering is a service. The product is anything that you can touch. So for example, biscuit, that is a product somebody is selling. Take medicine, the medicine is a product that is given to the patient and the customer. That's a product. But before the patient will get access to this medicine, somebody will have to render service. And so we say that the service is different from the product in the sense that service is intangible. Intangible, what I mean is that it cannot be touched. It is only experienced when it is performed. So the satisfaction, the attentiveness, the flow, the helpful, the sensitivity, tone, attitude is important as far as your service is concerned. So take note that service is intangible. It is only experienced when it is performed. And also service is inseparable in the sense that the client is required to participate in the production of the service. You want to take a haircut, but you are not willing to go and sit down for the barber to give you the haircut, then it means that you can't get that service. You want to be taken care of, you are sick, you want to be cured, but you are not willing to go to the health facility to go and will submit yourself to consultate, then it means that you cannot be treated. You went to the hospital facility, but you are not willing to go and pick a folder at the records end, then it means that you cannot be attended to. So service is inseparable from the customer. The customer must also participate in order for the service to be performed accurately and to be performed effectively. The service is also different from product in the sense that it is variable. Variable, what I mean that it is not always performed the same way. Hence, raises what? Perceived risks. So you could be maybe 2, 3 health information officers in that particular hospital or clinic or polyclinic or that facility. How the officer A will carry out his duty or render service there will be different from how officer B will be. So the importance, for example, the importance of this particular CPD is to help you say that irrespective of the number of people that you are running shift, whenever each of you performs a service or render a service, then the client should not find difference. They should be satisfied. If difference should come, it should be just a little variation. But once you all understand that this is what is needed to be done, and you do it accordingly, then the variation will be minimal. Then it is also important for you to understand that service is perishable. Once it is time for you to perform, you have to perform. If you don't perform it, that's it, you lose it. For example, I think recently we had our medical screening for the first year student, and then when it goes for them to compensate for the allowance, they were like, okay, few of the students didn't turn up. For that matter, they can't pay everything. The argument was that no, the service was rendered. Unless the management can prove that a student came for the service and there was no staff to render the service, then you can say that you will not pay. But once the individual was there at post for the dedicated period duration to render the service, but it is the student who didn't turn up, it means that the service is considered done. It is lost. That one to the disadvantage of the student, but not to the disadvantage of the one who was to render the service. So they needed to what? Pay without any problem. So what I'm trying to say per this slide, that service is intangible, it cannot be touched. It is inseparable from the client. It is variable and also what? Perishable. It's important to understand these dynamics. So service industry. So where, in other words, where is service rendered? So the service industry, you are talking about the healthcare sector where service is rendered. You talk of professional services like the marketing, accounting, legal, architectural, all these people render service. The financial services, so the banks and they all give services. Hospitality industry, the airline, they give services. Others, like the barbering shops, those doing the hairdressing, the pest control people, plumbing works, the health club, or counseling services. These are all industry where services are what? Rendered, or places that service is rendered. Now, understanding quality service and service culture. So it's important to understand what are the dimensions, what are the things that feed into service quality. Then the service culture with regards to your environment, with regards to your organization. What is your culture when it comes to service? So service quality, a framework we call the self-qual, if you want to do some analysis to see whether what you are rendering at your facility is of quality or not, then one of the framework that can be used or that's mostly used is the self-qual framework, which focuses on what? The evaluation that compares the customer perception with their expectation based on what? 5 dimensions, which are the tangibility aspect of it, or the tangibles, the reliability, the responsiveness, the assurance, and empathy. So let me put this across. I always say that if they talk of service, you perform service for the customer to be satisfied. If I come to the hospital and expect that, okay, I was having a headache. When I go through the system and go out, my headache should be taken care of, or after some few days, my headache should have subsided. So I come, and yes, they take me through, diagnose me, give me the medication, I went home, everything is done. They have not satisfied me because I was expecting that from them. Once they rendered exactly what I was expecting from them, then that particular health facility has not satisfied me. They have not excited me. And for that matter, it will be a bit difficult for me to become loyal, where I could be a loyal advocate for them. You will satisfy the customer, or you will elicit the customer in the course of your service delivery if you do something that the customer or the client was not expecting to be done. Now, I came expecting to be giving treatment for my headache to go. You did all that for me. I went away. Maybe in 2-3 days' time, I get a call from the said facility. They are all only calling to find out, how am I doing? Am I taking the medication? Am I responding to treatment? That is something I don't expect from them. Once that is rendered to me, I become excited. I sat down, and all of a sudden, I saw a team of people from that facility, that they are following up to see how I am doing. I was not expecting that from them, but they have done that. That becomes something that excites me. I went there, they said I should go to the lab. When I went to the lab, they said the results would take 30 minutes for me to get the results. So I should wait outside. As I was waiting, in some 15 minutes, the lab people came and said, please, here is your results. They have excited me. Because at the time they told me my results would take 30 minutes, that is what I conceived in the brain, psychologically. So I expected 30 minutes. But they gave me the results in less than 30 minutes. That at that point, we will say that you have what? Satisfied the customer. So when it comes to performing your service to satisfy the customer, you must do something beyond the ordinary. You must do something beyond what the customer is expecting from you. Then you'll be satisfying that individual. In that sense, you'll be building the opportunity for the person to become loyal to that facility. Notwithstanding the focus of service quality, it also incorporates satisfaction concept. So I think basically that's what I've explained. Okay, so we bypass that and go. But it's important as well that the quality of a service is its fitness for what? The intended use. If the service you are rendering me is not for the intended purpose, then of course there's no quality in it. That's how well the service was delivered or is supposed to have been delivered is critical for we to say that yes, you have rendered quality service. And this calls for a gap analysis. So it is important within your facility as self-information officer. I know that most often or part of your studies, you do data collection. So you can do an exercise to find out with regards to the quality of service you people are delivering. You do your questionnaire, let the your staff, they will feel, the clients will also feel, for you to understand even what is the perspective in terms of service delivery of that facility with regards to your own employees. Then you also understand the perspective of service delivery with regards to what? The clients who are coming to you. Then in the overall or in summary, you get to understand in terms of service delivery, where is the facility? When you get this information, then you can officially communicate that to management for them to what? Do the decision taking in order for the facility to move forward. So the elements of service quality, they are the reliability, as I earlier cited, assurance, tangible, empathy, responsiveness. Now, the service, so the dimension, one after the other, in terms of quality, service quality. So the tangible aspect of it, what are the things that makes the service tangible, or what are the things that you need to ensure for you to meet the tangibility aspect of service? The physical facilities. So your structure and design must be top-notch. They should not come and then washroom when they go, excuse me, it's a mess over there. Or even there's no place for them to use as washroom, then there's a problem. They should not come, maybe for them to locate one point of service delivery, they will go through several doors or they will climb several. The service flow should be there. Your facility should be appropriate. Where light supposed to be, there should be that light. Where there's supposed to be stairs, the stairs should be there. Where there's supposed to be a shed, maybe if it's raining, they can take cover, or if it is raining, they can take cover. Those things need to be there. Your facility or your environment should be spacious enough for the working to go on. The equipment that you use, it should be state-of-the-art equipment. So you cannot say, for example, you want to do, as a health information officer, you want to do data collection and you don't have the right questionnaire, or your questionnaire is structured such that when people begin to fill, then they become discouraged. It must be of quality. Whatever the health information personnel need to carry out this questionnaire, you need to provide at least a laptop or a lab part for them to do their work is important. If they that, I'm just in terms of equipment. If they don't have that, it means they cannot deliver the service they're supposed to render. If the facility is such that even blood film tests, they can't perform that. MPs, they don't have the machine or the microscope to be able to read under the microscope. It means they can't do MPs. Then there's a problem there. You need to ensure you have the right equipment available for the service that you have advertised to be rendering, so that when they come, they can provide everything. In fact, these days, what is happening, even when they come in a particular service, you can't give it there. What happens is that you, for example, there's some lab tests to done. You don't have the machine there. It is better for you to take the blood sample, let them do the payment there. You take the sample to another facility where you can run the labs and then bring it to them, so that the patient don't do that up and down. And that is what most facilities are doing now, so that you see the patient, when they come, they want to have like one-stop shop. When they come, they get everything there and go away. They are much happy with that. Then they'll come, okay, this one we don't have. Go and get this from here and come. Go and get this one and they can. It is important to ensure that your equipment are available and they are functioning, and whatever extra that is needed, you need to provide it to get it done. Then the personnel also should be available. So what I know, most often, this health information management people is mostly like one person. They will allocate you to a facility and they expect you to function appropriately, which is not right. So if the personnel too is not there, the person will have burnout and then challenges will come. The hospital, you have the required number of nurses, the required number of medical officers or PAs, physician assistants, the pharmacists, pharmacy technicians, are they available? It's important. I know that when it comes to staffing, it's a challenge in the entire nation. Then also the communication materials. What are you using to communicate with the patient should be appropriate. They shouldn't come, maybe want to even call them. There's no phone call for you to contact the patient and see how they are faring. So it is important that your communication tools are available and they're easily understandable. You don't have to communicate in such a way that they will have difficulty making sense of what you have. That's why I say, for example, you want to do a survey and then your questionnaire is structured so that when the people read the question, they don't understand it or they have to seek for interpretation before they can answer. Then it means you need to revise your questionnaire again. Then the reliability, it is dependent on the dependability or the features that give accounts of your reliability is that dependability. Can they depend on whatever is coming from you? The service should be delivered right at the right time. Don't deliver the service when it has passed or when it is not needed. You must deliver it rightly and at the right time. Then we'll say that you are dependable. It should be accurate. The service delivered must be as promised. If I say I'm going to give you the lab results in 1 hour, that's what I say, that it's important for you to, if at worst you can, give me the results at 1 hour. But if we come beyond lesser than that 1 hour, then I'll be way happy, more than happy, excited. But you cannot afford to go beyond the 1 hour you have given the person. Then consistency. The service rendered should always be what? Uniform throughout. And that is why I say that all the people who will be health information officers in that facility, you all need to understand that these things are required of you and you deliver them accordingly. So this is the most critical determinant of service quality, where customers expect service providers to execute accurately and timeously. Then the responsiveness, there should be a commitment. How well is your facility committed? How well you as a staff is committed to the service delivery is important. So employees should be willing to help customers and keep the customers updated as to when service will be performed. So if there's for one reason you cannot deliver, say, let me know, inform me, so that my anxiety will come down. The speed of delivery should be important. It should be timeous. Service should be delivered timely. As I said, don't bring it when it is not needed. Then there's no need for it. By that time, the patient would have been lost, or you go and do your data analysis, you bring it when the issue has been resolved. Then it means that you are late in your delivery, or you were late in carrying out that particular survey. The minute you are able to pinpoint it, you need to work on it very fast and provide or suggest possible solution for management to take it up. But you don't sit down and wait for management to come with a solution. They say, oh, let me do this. No. So it is important for it to be timely. The assurance, the knowledge of the service. So employees must be knowledgeable about their work to answer customers' questions. So we always say that in terms of service, it is important or it is incumbent for the facility to do internal marketing. And in this internal marketing, the facility must educate all their staff to understand what service they are rendering, what are the facilities available in the facility, what is the state of the equipment that they are using, what state-of-the-art facility do they have, so that they would then use this good news themselves and then preach to others. But if a patient comes and asks a question, there's least staff there, the security officer cannot answer, then it means that your internal marketing is poor, or your internal service rendering is poor. Everybody should be knowledgeable about whatever is going around in the facility, so that they will all become what? Good ambassadors for the facility. Then courtesy. Employees should be what? Courteous in all your dealings. Try your best to be as courteous as you can. You should be inspirational as an employee of that facility, so that you give some kind of confidence and trust to the clients who are visiting you. Then safety. Employees should make customers feel safe. Not that when they come, you are attending to them, they have problems, they are feeling insecure, but provide the environment so that they will feel safe as you are rendering the service to them. So this dimension put trust and confidence in the customer, who consequentially sees the employee to be knowledgeable about his or her service, coupled with la crème de la crème, courtesy. Okay, not that only you are knowledgeable about your organization or the job you are performing, but you should accomplish or accompany that with courtesy. Then they will be more than satisfied. So this will help in building a relationship. And so in relationship building, trust is essential to minimize risk perception, so as to have a fruitful relationship, mutually beneficial to all of us, or to all the people you are attending to, you as the service provider, and then the customer as a patient or the client. Then empathy, you need to put yourself in the shoe of the one you are giving the service to. So attention, service must be convenient, special individual attention. So some people are there, you have to give them special attention. Yes, that is not to disregard the point that service in terms of healthcare delivery, there should be equity. Equity in the sense that you give the same service to everybody. But you must ensure this equity, but then you can also have specialized service for what? Specialized fee for specialized people. So that one is also still there. It is not that when you are going to render that part, it's like you are disregarding some people. No, that is there as well. But you must ensure your equity in terms of your delivery. So empathy is a component of emotional intelligence that measures a firm's ability to provide individualized attention to customers. Now, the service culture. So depending on your culture as an organization, and this culture is dependent on your mission as an organization, and then the product and services you are rendering. Management support will have to come in. The policy directions and procedures will have to come in. Your employees' role and expectation. So you must let all the employees know their role and what is expected of them. You must let them be abreast with the policies and procedures. And management must render the necessary support for the employee to deliver that service they have set up the facility to provide, or the service culture they want the facility to provide. So the delivery system should be appropriate. There should be training and retraining of your staff from time to time. And of course, there should be what? Motivation and rewards. Institute a form of reward around, so that within the health information setup itself, that department, depending on the number of people, if you are the head of that department, you must see to that, okay, in your budget, you should put some elements of motivation or reward for your people staff there, so that as you reward the person, it becomes a source of what? Motivation for them. It becomes ginger for the person to do extra or to do more. The key skills for quality customer service. What are the skills in order for you to deliver quality customer service? We are saying that you should know your organization. You should be knowledgeable about the organization. Then you should know the product. In this case, know the services that your facility is rendering, wherever you find yourself. Know the kind of services that your facility is rendering. That is critical. Then you should know your customer. You understand the health information, but these people are, for them, it is so important for them to really know the clients that comes to the facility. Because when you get to know them, you get a lot of information from them to help the facility strategize in order to be what? Able to meet their unmet needs, or in order to also to fulfill their needs. So it's important that as a health information person, you should be knowledgeable about your organization, the services and products you are rendering, and then you should also equally know the customer that patronize your facility. Addressing customer needs and behavior style. So the customer, for example, they are coming to you. When they come, they want to feel welcome. So that is the need the facility must meet. They want to be understood as to when they speak. They want to be comfortable. If it is a chair you are offering them, the environment, they should be comfortable with the environment. Not that your environment, for example, you have a dustbin where they have been disposing bola, they come around, they are there, the scent is coming. No, the environment should be comfortable for them. They should feel appreciated. If the customer comes in and talk, they should feel appreciated. Thank the customer. Follow up after you have rendered your service. Go beyond their expectation, as I earlier on said, that for you to be able to satisfy that person or to excite that customer, you must go beyond the ordinary. You must go beyond their expectation to provide special offers to them. Remember special details about the customer. For example, knowing the person name, so that when you meet the person, you recognize the person by name. It is so refreshing for you to recognize a customer or a client by name. To them, they feel that, oh, wow, the people actually know me. It means that I am important in their life. That's how come they even know my name. So it is important for us to go that extra mile. Then still on the customer needs, they also want to feel important and want to be respected. They want to be important in the sense that the customer's name, I think I've earlier mentioned that. If you are able to know their name, they feel that they are important to you. That's how come. Because things that are not important, literally we don't care about them. Whatever happens to that, we don't care. But if it is important to you, it means you keep them in your good books. When they are talking, you pay attention to whatever they are saying. That was when it comes, especially with regards to attending to patients. It's always important to open up, first of all, listen to what brought them to the facility. After listening to them, you should appreciate their point of view of whatever they are presented and re-echo whatever they have said to be sure that all of you are on the same point or at the same level, for you to be able to give the right service that you want to give or the advice that you want to give in order to elicit feedback from the individual. So get to know that as far as customers or clients are concerned, they want to be respected, they want to be important, they want to be comfortable, they want to be appreciated. These are all things that they need or they expect to get whenever they come to you. Nonetheless, firms should not be afraid to confront what? Difficult customers or clients and fire or blacklist them. Do not put your employees through emotional labor. This note here, or this ending part, 2 points here, what we want to say that Because you have trained your staff to be of good behavior when it comes to customer service delivery, because you want to ensure quality service, and your staff, your internal customers, they are doing everything to deliver that. The client that comes to them should not take them for granted, should not disrespect them. So right now in the world that we are inside, as an organization, you have the right to blacklist a client you think that this person is taking advantage of your what? Service quality delivery to do something otherwise. You can blacklist that individual. There's a restaurant outside in the US that they have blacklisted somebody from entering that restaurant to eat because he decided to take their service for granted and then decide to do otherwise. So they just decide to blacklist the individual. You should not see a client that is frustrating a staff, but because you want to ensure quality service delivery, then you say that staff should endure it. No, you have to come to the defense of that staff because you realize that the client you are talking to is trying to misuse the system. In that case, don't give room for that purpose. So the 4 styles of behavior when it comes to addressing customer needs and the behavior style. So the dominance appears to be what? Quite busy. Okay, may give impression not listening. Like the person comes, your impression is like you are not listening to the individual, or you are busy. The person is talking, you are busy, you are doing something else. You pretend to be serious or have a serious attitude to work when you see the CEO or your supervisor coming around. It's a challenge. You have to voice out your opinions, but in a respectful manner. Influencing. You should have a behavior that is influencing or a style that is influencing. So appears quite what? Active. So that because we want you to be influencing others to be doing good, you appear to be quite active. That is important so that the other, but the point is that don't pretend to be very active when actually you are not active. In that case, the influence you are giving is a negative influence. You take social initiatives in most cases, and then you have to be able to encourage the informality involved in rendering your service. You have to express emotional opinion, your feeling. If you think that this is not right, bring it out. If you feel that, sincerely speaking, this is not appropriate, please bring it out. Under the dominant, we have the issue of you voicing out your opinion. Bring it out. It's important. Then you also need to be steadiness. Give the appearance of being quiet and reserved. Listen, because that will help you to listen attentively to other people. You should have a style that is able to tend to avoid the use of power. So it should not be like, I'm trying to show some power here. No, but your behavior style should be such that you are not overusing your power or you are not exercising power over somebody. You make decisions in a thoughtful and deliberate manner. Then, of course, compliance in whatever service you are doing, you must ensure that you are compliant with the laws, with the guidelines, with the protocols, procedures, management decisions, the organizational culture. You should ensure that you are what? Adhering to the organizational culture. Then the steps to resolve service breakdown. So if things are not put in place or you are not respecting the dimension of service quality, it means that things are falling apart. What are the steps that you need to put in place in order to resolve these breakdowns or to revive your service attitude? So to solve this service breakdown, so this note is saying that service breakdown occurs whenever any product or service fails to meet the customer's expectations. So once it occurs, you need to put in some steps in order to revive your entire service system. So one, in terms of service recovery, you have to express respect. The client came complaining about the service that was delivered to him or her. Then show respect to the person. Listen attentively to whatever they have. Once you are able to understand their concern in a respectful manner, you outline the possible solution for the client to be in the known. You need to listen to them attentively in order for you to understand. You need to uncover the expectation. So in listening to them attentively, you get to understand, okay, at the bottom line, what is this patient or what is this client or what is this customer expecting from me? That will help you in what? Outline your solutions. Then you take actions to follow through. That means action to ensure that you implement the solution and see to it that the solution implemented, they are impactful. And otherwise, the outcome is appropriate. Then, of course, you need to double check for satisfaction. Once you are implementing action to give the solution that you are proposed to the patient based on what caused the service breakdown, you need to go by and find out whether you were successful or not. So the steps to solve the breakdown, you have to what? Ensure roadblocks to service, what are the roadblocks to service recovery? Not listening to the client or the customer. Your lack of respect, lack of training, work conflict. You know, the work conflict, for example, that was said that, don't forget, we said the customer, you also have internal customer, which are staff. If two staffs are having problems there, it means that it can result in what? The breakdown of your service. So it's important to ensure that every staff within the facility, they are in good harmony to carry out their work, because their work is interdependent. If because I have a problem with you, I need to push forward this document for this patient, but because of that, I am delaying or being reluctant in doing what I'm supposed to do and delay the delivery of your aspect or even my aspect, it means that it will lead to the breakdown of the service. So every effort should be put in place to ensure that work conflict is resolved. Yes, service also break down because of poor or inadequate communication. That's why I say that if that you sense the breakdown or you sense something that will result in a breakdown, quickly communicate to the client or the service. Yesterday, for example, I was telling one professor in Napa West, yesterday between the 8 and about 11 something, there was no network. You can't make call. You don't have access to data. Silent, nothing. I don't know whether it was the entire country, but nobody gave us information as to what was happening within that period. So within that particular hours, it became like if we need person, you must go to wherever the person is first before you can communicate. But we didn't get any communication from any of the networks to tell us what was happening. So inadequate communication can result in a breakdown. And inadequate materials or equipment, of course, will result in what? Service breakdown. If the machine, FBC machine is not working and you don't repair it, why won't it result in service breakdown? It will delay output. It will not give us quality of service because we will not be able to give appropriate diagnosis. And for that matter, the correct drug will not be given for the right diagnosis. That will result in service breakdown. So the steps in identifying the service strategy. Steps in identifying service strategy, you need to determine the most important service attribute for meeting and exceeding customers' expectation. You need to determine the most important service attributes on which competitors are most vulnerable. So the other health facilities, where is their vulnerabilities? Then you need to take steps to let that become an advantage for you. You need to determine existing and potential service capabilities of your company. What do you think? You are in the cell. What is your potential so that you maximize on it? Okay, there are some capabilities that can be utilized, but they are not in use. So you make use of them as well. You need to develop a service strategy that addresses important, enduring customer needs, exploit competitor vulnerabilities and potential. Then it will mean that you are actually on the right course. That means you yourself need to do your SWOT analysis, know your weaknesses, address them. Then you need to do a SWOT analysis for your competitors at the blind side of them, leverage on that, put in measures to maximize from that field, and then you see that it will improve your service delivery, it will improve your numbers or the people patronizing you. So 4 core elements of service strategy, you are talking about the service reliability, service surprise. That's what I said, that you do something that they were not expecting of you. You have surprised the individual. Then once there's a breakdown, you must see to it that you recover that service for that individual. Or at least, if it cannot be recovered, then you provide what? Compensation. And then your service should be fair. There should be fairness. So as I was saying earlier on, you realize that a particular client is stressing another internal customer, that's your staff. And then you decided to still go on the side of that client who is frustrating your internal customer, your staff. The other people sitting by watching, out of that, they will take their decision. If your facility will still recognize or be able to accommodate somebody who is entirely wrong, then it means that for me, I will no longer patronize your facility. And there are people that take that kind of a decision because they realize that that is an injustice that is being rendered here. So when you notice that the person is not doing what is right, you have to come in to correct it so that the others sitting by will be excited about your intervention and the remedy that came in, which is fair before everybody. Then it will encourage them to continue to patronize your service or your product. So the service reliability, it needs to be accurate and dependable. Your service surprise, you have to find ways to make the customer say, wow. As I earlier explained how you can make them wow. Do something beyond their expectation. Okay. Then the recovery involves regaining the customer's confidence if the service is deficient, or it means there was something wrong with the service that you provided. Then fix it, recover that part, and then the person will be good to go with you. The level of playing field for company and customer, the business should be conducted in an ethical manner or in an ethical environment. Everybody should see that whatever you are doing is fair to each and everyone present there. Not that you have special treatment for some people, but what we are doing is fair to the layman's view. So to conclude, the perception that the customer is always right has changed in today's business scape, and that the customer is not always right. Don't forget I said that you can blacklist the individual if you think that what the person is doing is ethically not right and it is inappropriate, you can blacklist the person and say, please, this person, whenever he comes, nobody should attend to him or should not be entertained within the facility. Witnessing illegitimate complaints of other customers and the subsequent service recovery aimed at those complainants impact the behavioral reactions of customers who witness that situation. I think earlier I said that those standing by, when there are this person demand is illegitimate, but you granted it, they can just take a decision on that and say, we will no longer patronize you. So it is important to understand that the business world that we are inside right now, the customer is not always right. You must just do what is right before all, what is legitimate and fair to each and everyone, not to specific people. And with that, some of the reference that I rely on, I'll say thank you so much for listening, and I'm ready for any contribution to add to the knowledge here, as well as questions for us to see. But I hope I was laudable enough for each and everyone. Thank you, sir. Hello, moderator, honorable moderator. Please, I am done with my presentation. Hello.
Yes, hello.
Yes, please, I'm done. So if you can take over, let's find out anybody with contribution to this, any question, then we attend to that.
Okay, thank you. Thank you very much, Doc, for the excellent presentation. The floor is open now. If you have any question, kindly put up your hand and call upon to ask your questions or make your comments. If you have questions too, you can post it on the chat box and we'll read it out for Doc to respond to that.
Now say equally any contribution to reinforce knowledge is knowledge we are sharing. Because I know there are people here who even have much knowledge in this than I do. It's just an opportunity you granted to present. That's the world we are inside now.
Thank you so much. So, Mr. Joseph Tete Akli, your hand is up. Kindly unmute and proceed.
Yeah, Mr. Joseph, you can unmute and speak.
Yeah, thank you, sir. Good afternoon, and thank you to everyone, to Doug. Please, my question is two. One is, in our facility, we have this Stambra colleague, and whenever he speaks, you hear some punch behind communication, and sometimes you see clients complaining about him. That because timeless, because of their condition, this like when they're communicating is direct. How do I maybe through this help the colleague? And then the next question is about blacklisting customers. Yes, some people when they come in their mind they are ready to come and cause confusion. They've done several times, but our service is kind of doesn't support staff who maybe talk towards clients who misbehaves. The policy and law say that they are considered as people who comes with not being the right frame of mind and all that. So we are not being supported as a staff, whereby the facility will support you. Rather, they will handle you as a professional who is supposed to be to handle issues professionally. So how do you do with this blacklisting of customers? Please, if you can understand me, thank you.
Thank you. Thank you very much. Doc, can you respond to that before you continue, sir? Hello, Doc. Honorable Senam, is Doc muted?
No.
Hello.
Yes, we can hear you now.
I just sent a message. I couldn't unmute myself. I was saying she was mute. But I think I can be.
Go ahead, Doc. Yeah,
I'm
go
okay
ahead.
now. Yes. So, yes, with regards to the one stammering, so once that person is an employee of the facility and they are all aware of his stammering, it means that when there's, for example, one way is that when there's pressure, you don't allow such a person to be at post because the pressure will even worsen the case. Aside that, it's also important for you to help the person to be speaking one after the other so that it becomes like a style of speaking. They should be slow, and so it's about encouraging the person to begin to try and be speaking like a one word after the other. That will minimize the rate at which they are stammering. But what I'm saying, first of all, don't let the person be at post when there's pressure. Then help the person to speak one word after another. I know somebody, you will not even know the person is stammering because he has adapted the attitude. You would think that, okay, he's the type that will mention a word at a time. You know, some people naturally will say these are slow speakers. They will mention one word, it will take them seconds before the next word. So you can encourage such a person to be doing this because that is a natural issue the person came with. You can't change it. But what you can do is encourage the person to work on it to try and what? Minimize it. And you don't put the person at point of service where there's pressure. It's all way in trying to control them because yes, the person also need to work. Even if it is possible, the person can be withdrawn to back office duty, but still be a staff. That is still welcoming. So that those that are okay, you push them to the front of the client. I hope at least I've helped in this regard. Then the blacklisting. The blacklisting of a particular client or customer will not be done by you, the internal staff, or you, the employee. It is a managerial decision. But it means that, first of all, you have to report as an employee that this client came and this also and so. You think that it should be addressed so that they will invite, management will invite such a person to come for them to hear that person's own side of the story. You know, interestingly, what happened is that most often the staff will not report. It is the client or customer who is quick to come and report. And then, unfortunately, management are just looking at, hey, I want the money, don't chase the people. Then they will come attacking the staff. But customer service or marketing is telling us that now we should drift away from that practice because people are making use of that opportunity to make illegitimate, it means unwanted demand. It means that undeserving demand. People are using such an opportunity to request to make undeserving demand. It means something that they don't deserve, but they are just using this opportunity to do that. So it is important that as staff of our facility, we begin to report when we feel that a client has done something untoward. You report to your immediate supervisor. It is his duty to carry it to management. And it is for management to take up the case. And of course, they'll involve a health information officer here. Or if they have a relationship marketing officer, they will invite the person here for them to understand what actually transpired, to come out with a decision. And of course, whatever decision that will come will be to fortify the strategic point of view of the institution. But what we are also cautioning against is that right now, the owners of businesses and management of organizations should not always brush out or brush aside the whatever that will be illegitimately handed over to the employee. If the person is not doing what is right, please, that will say that yes, sometimes you can caution. If you caution the person, you realize it is becoming repetitive still, then you can blacklist the individual. But I'm saying that this blacklisting will be done by the management. It is not you as an employee. You as an employee, the role you can play in getting that realized is for you to report the incidents. So let's desist from the perspective where it is only the customers or the clients that are reporting us. But we as staff, we as employee, we are not reporting customers to management or to our supervisor. So we should stop that practice. I hope it's clear. The one who asked the two questions.
Well, Doc, so the one who asked the question, I can make him out. But let's take other questions. I'm sure the person should be clear. If you have a follow-up question, please raise up your hand so I can unmute you to speak. Very well, Theophilus. Unmute and speak to us.
Hello, Doc. Good afternoon.
Good afternoon, sir. How are you?
I'm doing great. And you?
Wonderful. Thank God.
Oh, thanks so much for a wonderful presentation. I am very lucky to be the chairman of Safe Care Quality that we are running in our facilities, which is SD Hospital, Kwadaso.
Okay.
And
I know about Safe Care. Right,
Safe Care.
Yeah, I know about Safe Care.
Exactly. Okay. And with what you have presented today, you know, all falls within what we are practicing. And the challenge that we are having, that individual, especially the in charges within the unit or department, mostly don't own what we call quality. So it becomes a bigger challenge when you are running what we call quality in some institutions, especially ours. Recently, I was assessed, and we did so much, but we are still on level 3 under the Safe Care. But you could see that most challenges were coming from the unit heads and the in charges for both departments and other units, that what we call quality, they don't even understand. So it's a huge job. Oh, it's a huge job. Once again, sometimes management also have their own issues in terms of the implementation of what we call quality in our various, facilities. So I am also urging that with what we are learning, most of it should go to, or we should get involved, the facility heads and some of the management members. So therefore, they can also appreciate exactly what we are learning. Then it won't be like we are trying to enforce certain things to them. Please, Doc, I hope you understand what I'm coming from.
Yes, please.
Yeah. So I will once again urge that, I don't know, maybe if we can still do this again the following year, then we should involve the management heads and the facility heads to be part of what we are learning. Then, it will really help us for us to also do what we're supposed to do. Thank you so much.
Thank you, sir, for your input. So yes, you see, when it comes to service, let me just put this out. When it comes to service, so in the presentation, I spoke about service culture. The service culture for each facility is different. And it is for management to sit and then come out with the service culture. But for management to decide that service culture, they need to get the buy-in of each and every staff. And before they can get the buy-in of every staff, it means, first of all, from management, they must get the buy-in of all departments heads. They must get the buy-in of all units heads. They must get the buy-in of all in charges for them to be able to establish the particular service culture that they want to have. In terms of the service quality they want to deliver, that's why, first of all, management must support. They have to take it. It is a strategic decision. Once they take it, they must first of all bring in the department heads. They have to buy in. Then they have to, everybody, before you then come down to the entire staff. If we don't do that, the challenges my senior managers came up with, we'll be having that. So you realize that you want to do this, the in charge himself or herself is not ready. Then you have challenges. And for safe care, I know that when they initiated the first of all, it was the management, the normal, first of all, meet management, this is the case. Then it is for management to inform the unit heads. After that, they then have even there's a training for all the unit heads. So I'm a bit surprised that as at now, per your presentation, you have unit heads that are not buying into the idea. Then what was the training for? It comes back to explain that, you know, in Ghana, we have some attitude. It's like you have been taught the thing or you have been trained, but we don't want to implement it. Why? When you begin to talk, and it's not that they don't know, they know, but they will not implement it. Why? If the same person is thrown outside this country, you will see they will do wonders. So it's like we've been truthful to ourselves. Let's stop being hypocrites and all come on board, because that quality of care is to everybody. Me, I always, anybody that comes under me to train or is working under me, I tell the person, I want to make sure that whatever I know, you equally know that and can do it in my absence, so that tomorrow, God forbid, I am involved in an accident and then I hear that it is you who is coming, I'll be happy. Not that I'll know you are coming to attend to me, then I'll put my hands, or I'll say, okay, just kill me. So please, it is important for everybody to always be on board. And once you are trained as a unit head or as an in charge on a particular mission, it is incumbent for all of us to execute that mission. If you don't do it, then the other employees will not be willing to do the work. So I understand the frustration my brother is sharing here. Is it like, please, I said that clinical meeting. If I come to the clinical meeting and use the head of the ward, for example, ward in charge, you are not there, then I don't have any right to blame a nurse who is not at the meeting. Because you, the in charge himself, is not there. So it is you I will take on. You, the in charge, need to be there. When the in charge is there, and then the particular nurse is not, it is then the in charge can then, why are you not there? Then the person will be forced to be there. So please, it's important to always ensure that everybody is on board. But it shouldn't be that management should decide and not involve the unit heads or in charges or other heads of department. They need to bring everybody to agree. It's just, you know, it's a strategy, something, it goes into your strategic plan. And the strategic plan, everybody needs to be part, because you normally see, for your information, first of all, from the staff. Then from there, you go to the in charges, you go to the heads of department. From there, you go to the management to now develop the document for your strategy. So it will be weird that we don't want to help when we have to. So please, let's all help for our own good. Thank you.
Thank you very much, Doc. Any other question? Right, I want to acknowledge those of our colleagues who are watching live from YouTube. We have some number of our colleagues who are streaming live on YouTube. Registration link have been sent to them also to register. So we acknowledge you today. For the past 2 days, we are unable to acknowledge you. So today we are acknowledging those of you who are watching us live on YouTube. The registration link have been sent to you as well for you to register. So we'll take some few questions more, and then if Doc is done addressing them, we'll pick some few announcements and then we call it a day. No more questions. Doc is available to respond to your questions.
Yes, please, I'm here.
Well. Augustine Piney, do you want to say something? Okay, we have Mr. Sarkodie Andrew on. So kindly unmute and speak.
Good afternoon, Doc.
Good afternoon, sir. How are we?
I'm doing very well by God's grace. So,
wonderful.
Doc, thank you very much for the wonderful presentation.
You're welcome, sir.
Thank you. Doc, you on the service quality, you gave some components, tangibility, and reliability, and other components. How do you measure the reliability? If you want to measure the reliability of service quality, what kind of sort of questions can you put in order to be able to elicit the reliability, the reliability of service from the client perspective? What kind of sort of questions that can you put across in order to elicit that important views from the client?
Okay. So the reliability is the dimension. So in what you use to measure the reliability is the dependability, the accuracy,
Okay.
the consistency.
Okay.
So if you want, because the client came, that's what we say, that they expect for service to be delivered rightly and at the right time. So you should set your question and find out, okay, for example, as I was in my presentation, I said, for example, lab. Your question should be like, when you come, how many hours do you spend at the laboratory? How many hours did you spend at OPD? How many hours did you spend in the consulting room? How many hours did you spend at pharmacy? In overall, how many hours did you spend in the facility to get your service and you went out? I hope you are getting me.
Yes,
then,
Doc, I'm getting you.
Yes. Then the other part, there's lab result that was given. Before, do you think that it was right? The diagnosis or whatever that went through the consulting room, do you think whatever that was done was right? Was it at the right time? So those are the questions. Like, it depends on how you frame your question to measure the dependability. If the customer gives you a very good response, then it means that you are measuring your dependability with regards to the reliability. Then you do the same. Your question should be the same thing with regards to the accuracy. So how accurate is whatever that was done to you? Because you must what? Omit errors. For example, you find out from the lab, this FBC results that was given, how accurate is it? In other words, based on their results, you find out whether they are able to, did they calibrate the machine that day before they started writing, performing tests for patients? If you cross it and you realize that they have done those calibration, then you will know that what they are giving you is equally correct. With time, the facility can even say, okay, let's compare our results to the results from another facility. It means that I take a certain sample, you run the test there, then the same sample, you send it to a second facility, let them run, you compare. You understand? Now the person came from records, supposed to go to OPD desk. And then from records, the person didn't go to OPD there, but went straight to consulting room. It also still go against accuracy. I'm just giving depending the department I'm picking for you to understand. Okay. So you need to get questions to measure that accuracy. Because don't forget that sometimes when inspectors can realize, for example, take malaria case, they will want to see that, yes, the patient actually came to the facility. So from records, they have to attest that from the attendance. Then they have to go to OPD desk for was the patient captured at OPD desk? Then the same patient they are following at consulting room, was the patient captured in consulting room? At lab, they will go, did the patient pass through lab? Did they run tests before they, for example, pronounce the person to be having uncomplicated malaria? What was the test results from the lab? From there, they'll go to the pharmacy. Okay, the person was pronounced positive. Was the person given medications? The person was negative to malaria. Okay, was the person still treated? You get that information from the pharmacy also. At the end, you understand, okay, whatever was done was right, was accurate or not. So if anybody is dodging anything, you also get to know, there's a breakage here. From here, this didn't happen. So that is why documentation becomes what? Critical. And that is also part of you put your end. The quality of data becomes critical. So this another way you can measure your accuracy is that. Then the consistency. So you know that when the person comes, supposed to go to records, records to OPD, OPD to consulting room, lab to pharmacy, or a lab to ward, or to in that. So is that what is going on for every patient? So if we run that kind of service for this patient A, patient B, is it the same thing that you did? We are measuring what? The consistency. So based on whatever results you get for your dependability, your accuracy, your consistency, then you can then say that, okay, the service that we are rendering, reliability is covered. Because you realize that your service, you are dependable in your delivery. We realize that you are accurate in terms of your results, or in terms of your pronunciation, you are accurate. They will also measure that, okay, you are consistent in terms of your delivery. Not that, for example, when it comes to manufacturing, let's say you manufacture, you produce bread. They eat the bread, people are satisfied, they are happy with your bread. Tomorrow they come from you again. But this bread, there's some funny taste in that bread. Then it means there's no consistency. Because if you, the same person who produced the bread yesterday, produce it today and there's difference, there's no consistency. And that is what feed into drugs manufacture. We want to be sure that the batch that is produced today, it meets the specifications. Tomorrow, another batch is produced using the same equipment, everything. It should produce the same specification. It should meet it. Then we'll say that there's consistency. Once there's no consistency, even everything will come and close you. So it's the same thing. If you realize that your facility, the service they are rendering, there's no consistency, then it means that there's no need being there. It means you are failing at reliability. So that is how you can measure all those dimensions that I highlight. The tangibility is the same thing. So your facilities, physical facilities, you need to access them, find out, there's a building collapsing somewhere. This one is leakaging when it is raining or in the night. Patients have been falling because no light. Then there's a challenge. Do you understand?
Yes, yes, I understand very well.
So those are the parameters that you use to measure them based on your results. Where you see so tangibility, your physical facilities, equipment, personnel, communication material, your reliability, the same, you have your dependability, accuracy, consistency, the responsiveness, commitment, how committed are your staff to delivering the service? How committed is the facility to rendering the service? If top management are not committed to it, then there's a fallout. If the in charges are not committed to that task, then there's a breakage. The speed at which the service is being delivered is important. Your assurance, the knowledge of service, your staff, are they knowledgeable in the service they are rendering? Are they knowledgeable about the facility itself? Do they deploy courtesy in the execution of their services? Do they inspire people? Do they inspire others, their subordinates, to also do the same? Do they, whatever they do they satisfy your specifications? Do they meet or exceed what the customer is looking for? Do they pay attention to attending to the patient? Do they want to place themselves in the shoe of the patient and attend correctly? Then you'll be able to measure your service quality. I hope I've helped you.
Thank you very much, Doc. Thank you very much.
Most welcome.
You have. Thank you.
Any more questions, please? Right, Augustine. Please unmute.
Thank you very much for giving me this opportunity. I'm Augustine from Holy Child Hospital. There's this, what do you call it? When the staffs, those are the stubborn staffs in the facilities, when they commit crimes, mostly they push them to the records unit for them to come and work over there. But as we have been going through these workshops, normally when we go back, we train them. But there are some people that they are difficult. And then they've used the record unit as the prison yard for the hospitals. And when they commit any crime, they push them there. In this case, what should we do as the record staffs or the head of? Thank you very much.
All right, thank you. But yes, your concern is basically what is happening, which is not right. But you see, I always say that it's dependent on who is the head of that unit, who is in charge of that unit. Because I should have some criteria. This is the action on the action plans. Records supposed to do this, and I said that the staff, this is what I need them to be doing. So if you think that a staff in a particular unit is not performing, you are bringing to records. I will tell you that the person, I don't need the person in records. So take the person to another place. The best would be for them, for management to take up that particular staff scenario. First of all, that means disciplinary committee, they should be, if the person needs psychological support, they do that. So what kind of reformative strategy management is having in place for them? If they don't have any reformative strategy, then it should not just be that damn them at records. And if you are bringing the person to records, it's of no use to me. I'll tell them, send to another unit where the person will be useful. But the point is that management must take it and find out even why is the person not producing or not being productive at a particular unit, or this person is just stubborn. So once you that this one is there, no matter what you do, nothing can be done. It is at this juncture that management can decide to, okay, we are releasing the staff. You see, the point is that, especially the chat facility, most often they'll say, oh, they want to try to have messy. So they'll say, okay, then transfer the person to another facility. If the person attitude said they cannot be tamed, why should you transfer the person? Yes, some people are there that once you change the environment, they change. But you do that, you realize that they are moved the same person from one facility to the other. Just lay off the person. Once the person is not conscious enough after all training or intervention to try and change the person is not adapting, then you just have to lay off the person. But if using the records at the first point of place to dump them, the one way to minimize or mitigate that is for the in charge to say, okay, this person, we don't need him or her. They should take to a different facility. I think that's an option there. So it's about the in charge or the head of the department knowing what they want and accepting what they want.
Okay. Thank you, sir. Thank you very much.
Most welcome.
Yeah, my moderator is back on. Please unmute and speak. Mr. Nas.
Yes, thank you. Thank you very much. And thank you, Doc, for the presentation and the responses. I just wanted to add on to the last bit. And you were very right that it has to do with leadership, both leadership at the facility level, the facility management, and also the health information unit leadership. And this also has to do with regulation, because every profession is being regulated and every professional is being licensed to provide a specific job or some specific tasks. And so if someone is not licensed is being sent to come and provide a service in an area, then the unit head have all the right to draw management's attention to ensure that the right thing is done. Just as a health information officer cannot be sent into the theater to go and do surgery, or a health information officer cannot be sent into the pharmacy to start dispensary to start dispensing medications. It's the same way you cannot send any other person who is not having the training and the license to come and work at the health information unit or the records unit. So it is all about leadership. And so it is good all of us are here and we are discussing this, that our various unit leadership should take this up to ensure that all these issues that are happening in the various health facilities, are resolved. If they are not resolved, you can bring it to the attention of the association. We'll draw the attention of the Allied Health Professions Council to ensure that they implement the law to the latter. And just to also add, health information, as Doc said, is the face of every health facility, because usually that is the first point of interaction after the security. The next place is health information. And so if things goes there wrong, or if wrong things happen there, the wrong impression is already made, or the customer already have that wrong impression. And sometimes there is little that can be done to correct that particular impression. Remember first impression always. And so we need to sit up. Our leadership need to take up this to ensure that the right things are done. Thank you very much, Doc. And Honorable Senator, you can continue, sir. Thank you.
All right, thank you very much, Honorable Anas. Is there any other question? Right, I think we've spent much time on question and answers. So all too soon, we've come to the end of today's session. Distinguished members, we've come to the end of today's section, and then today's presentation on customer care in healthcare settings by our very own Dr. Maxwell M. Sampson has been very, very enlightening. I am sure that we have all gained valuable insights into how we can treat our customers, knowing that, it's a central points of improving, client satisfaction, trust, and overall our healthcare outcomes. So on behalf of the Ghana Health Information Management Association, I want to extend our heartfelt gratitude to Doc for sharing your knowledge with us, and to all of you who participated, who asked questions, and who contributed. Inform the House. The registration link is still on the in the chat area, so let's go in there and then register. And also the Allied Health link is also on our pages. Let's ensure that we register or we complete that survey as well. It is very important. Tomorrow we would continue with our CPD training. I don't know if we have any other announcement. Honorable Anas, please, you have any announcement?
Okay, thank you very much. Not an announcement, but just also to add my voice to thank Doc. Doc, it's been a pleasure having you. You have been a very valuable addition to our CPD series. I have attended a number of customer trainings programs, but I must confess that this has been very elaborative. And with all the experiences that you have blended with within the context of the health information management, I think that it is something that is very, very valuable. And we can never thank you enough. We only hope that you will continue to be available for us to also continue to tap your knowledge for our members to build up their capacity. Thank you very much, Honorable.
Thank you very much. I also want to acknowledge the presence of all regional governors on call, all national executives on call, and then Council of Elders, if any of them. I see Honorable Aaron Allo on call. I've seen the Dean of Governors, Honorable Jojo Brown, also on call, and all other governors who are on call today. I want to acknowledge all of you. So on that note, as I was saying, tomorrow we will continue with the CPD training on the topic emotional intelligence in healthcare, which will have a resource person who will be taking us through that very topic. So we are looking forward to seeing all of you tomorrow once again at 2 p.m. prompt. And I want to urge you once again to register. So thank you all for coming. And then I would want you to have a very good evening. We earlier had a devastating news. So, I mean, a lot of us have been very down before the meeting started. So, it's been a Black Friday for Ghanaians at large. So, have a good evening and then see you the same time tomorrow. God be with us all. Bye.